Well, welcome back to my channel. I'm Dr. DuPont. I'm a board-certified gynecologic oncologist. And today, I want to hear from you. I put a video out last year just asking for comments on what you want to see. I'm happy to make any video that's kind of related to GYN cancers, but I want to hear from you. So last year I put a video out and just asking for feedback. What do you want to see? What content can I produce for next year that would be interesting to you? And I didn't get any responses. I heard crickets. But I wanted to do this again this year because I really want to know what I have seen through looking through my YouTube channel, looking through my analytics, and looking at the comments. I do read every single comment. I don't always respond to some comments because sometimes I feel, that I can't give individual advice, but I do read every single one. And the comments do help me know what questions or concerns are important to you, because I really do want to make content that is helpful to help you grow in your personal health, but also that'll help you educate, your sisters, your family members, your, parents. And so I definitely want to be able to do that for you. So I have noticed that my surgery videos are extremely popular. So I'll keep doing that. My plan is to do at least one surgery video every month. So I'm going to do that for the next year. And then also I do make some videos on menopause and perimenopause. Now those haven't been as popular, but I am a certified menopause practitioner. And I do see a lot of patients in the office for menopause and menopause related symptoms. When I started out in training, I got very little training on menopause, so I've had to educate myself. So since I'm a G1 oncologist, I see patients who've had cancer. And so what I've learned is that once patients are cured of their cancer, well, they have a lot of complications from their surgery. So whether they had radiation, they're having vaginal dryness, or they had, ovarian cancer and they had a hysterectomy, and now they're in surgical menopause, the survivorship part of our cancer journey is very different. And I wanted to refer my patients to people that could help them, but I couldn't find anyone to refer them to. So I educated myself and I literally became an expert just because I wanted to be able to provide my patients with the best evidence and the best information. Now, when I talk about hormone therapy, I'm a G1 oncologist, so I'm looking at it through the lens of a cancer specialist. And so my treatment recommendations may be different than what's in the popular press, but my main focus is making sure that women, are on the right dose of hormones if they need it. I do know that not everybody needs hormone therapies, but for those women who are symptomatic and need it, I want to make sure they're on the right dose that controls their symptoms. But also, I'm also worried about, cancer risk in the future and, heart disease. So I do think of hormone replacement therapy maybe a little different than others, but I am trained in it and I have been certified by the Menopause Society. And I do point my patients to the Menopause Society's website. They have a lot of great evidence-based pamphlets and educational material for patients that I highly, highly recommend. So if you haven't seen it, check it out. It's menopause.org. So in terms of this channel, if there's anything that you want to know for next year, I can also, bring in guests. I do have a few lined up for later this year. And so surgery, menopause, I also talk about common GYN conditions. Last year I did a series on, bacterial vaginosis that was really popular, yeast infections, because I do see those a lot. And women do get those general infections. So if there's other things that are interesting to you that you want to see, please put them in the comments below and I'll be happy to make that video for you. Well, anyway, thanks for watching and I'll see you in the next video.